We want to remind our listeners that this program is for informational and educational purposes only and not intended to substitute for professional veterinary medical advice, diagnosis, or treatment. The Animal Medical Center does not recommend or endorse any products or services advertised by SiriusXM.
Welcome to Ask the Vet with Dr. Ann Hohenhaus. This is the place to talk about your pets and get advice from the top veterinarian from the Animal Medical Center in NYC. Hear from the leading authorities on animals and ask your questions. Now, here's your host, Dr. Ann Hohenhaus.
Hello, everyone, and welcome to Ask the Vet, a podcast for people who love their pets and want the latest in pet health and animal news. I'm your host this week. I'm Dr. Ann Hohenhaus. I'm your host every week here on Ask the Vet. I'm a senior veterinarian and director of pet health information at the Schwarzman Animal Medical Center in New York City, where I'm recording from today on New York City's Upper East Side. With the warmer days ahead, many of us will be spending more time outdoors with our canine companions, and outdoors means an increased risk of leptospirosis. Leptospirosis is a serious bacterial infection that can lead to life-threatening kidney and liver failure. It's also a zoonotic disease, and that means that people can be infected with the leptospirobacteria as well. So for today's show, it's going to be a record because I'm going to be joined by three guests, all experts from the New York City Department of Health and Mental Hygiene, and they're going to update us on their work related to leptospirosis in New York City and will help us to understand how we can protect our pets and ourselves against this bacterial disease. The Schwarzman Animal Medical Center is the only level 1 trauma center in New York City, and we've been the very best place for pets for over 110 years. If you want advice on maintaining your pet's health, then I'm here to help. You just send me your questions at our Ask the Vet email, which is askthevet@amcny.org, and I'll answer your questions on next month's Ask the Vet program. Now, if you don't have a pen or pencil, I'll give it again later in the show. But if you have one now, remember it's askthevet@amcny.org. And now it's time for our trending animal of the month.
It's time for the internet's most talked about animal.
This month's trending animal is Flacco, the beloved Eurasian eagle owl who made headlines last year when he escaped from the Central Park Zoo in February. After surviving for more than a year on his own here in the Big Apple, Flacco has sadly passed away after colliding with a building on Manhattan's Upper West Side. Flacco attracted worldwide attention and became a symbol of freedom and resilience after living the first 12 years of his life in captivity. And while there were concerns about his ability to survive on his own in New York, he was found to be in otherwise good health, according to the autopsy report after his death last week. He weighed nearly as much as he did when his weight was last taken at the zoo, which helps to confirm what we all knew, and that was Flacco was a great hunter. This sad news prompted New Yorkers to gather at one of his favorite trees to express their condolences, pay their respects, and establish a memorial for our beloved eagle owl. And while he may no longer be with us, his spirit lives on in those he inspired around the globe. For wonderful, wonderful photos from everybody who loved this owl on Twitter, or currently known as X, try the hashtag Flacco, F-L-A-C-O, or BirdCPP, and that will get you to lots of wonderful pictures of this fabulous bird. And now for our guests. At the end of last year, New York City Department of Health and Mental Hygiene released its annual report to veterinarians on an important infectious disease, leptospirosis. The report sheds light on the prevalence of leptospirosis in New York City and its impact on our canine companions. So after several years of declining infection numbers, this recently released report found that the cases in dogs ticked up in 2022. In total, there were 20 confirmed canine lepto cases in the 5 boroughs in 2022, and in 2021, only 18. As a New York City veterinarian, this report concerned me, and pet owners should be concerned too. So to dive into this future, it's my pleasure to welcome today's guest, 3 distinguished experts from the New York City Department of Health and Mental Hygiene, Dr. Slavinski, Kevin Lovingood, and Caroline Bragdon. Dr. Slavinski is a public health veterinarian with the New York City Department of Health and Mental Hygiene. She received her DVM from Michigan State University and practiced small animal medicine for several years before pursuing a master's in public health. She worked for the Centers for Disease Control and Prevention as an epidemiologic intelligence officer, after which she came to New York City, where she serves as the director of the Zoonotic and Vector-Borne Disease Unit. She's a diplomate of the American College of Veterinary Preventive Medicine, a member of the National Association of Public Health Veterinarians, and also serves as co-chair of the National Compendium of Animal Rabies Prevention. She's a member of the Council of State and Territorial Epidemiologists, where she participates in the Vector-Borne and Zoonotic Disease Subcommittee. Also joining us today is Kevin Lovingood. He's a zoonotic disease epidemiologist, again, with the Zoonotic and Vector-Borne Disease Unit at our Department of Health here in New York City. And he conducts surveillance on leptospirosis and avian influenza by investigating dead animal clusters reported through the NYC 311 phone system. He's also a One Health coordinator and works with colleagues in animal, human, and environmental health sectors. He has a bachelor's degree in microbiology from San Diego State and a master's degree in public health from NYU. And our third and final guest today is Caroline Bragdon. She's the Director of Neighborhood Interventions for the Pest Control Services of New York City Department of Health and Mental Hygiene. She works to develop and improve neighborhood-level responses to rat infestation. Currently, she's overseeing a large rat reduction program, which includes 3 boroughs and 5 agencies. Her bachelor's degree is in community health and social psychology from Tufts, and she too has a master's degree in public health, but hers is from the Johns Hopkins University. Kevin, Sally, and Caroline, thanks so much for joining me on Ask the Vet today.
Thank you so much for having us. What a treat.
So this is the first time I've had 3 guests. I've had 2, and the difference is that when I had 2 guests, the 2 guests were in 2 different places, and we did all of this by phone. I'm not sure Zoom was even invented then. Much easier now to do it in Zoom, where I can actually see you guys and, see if you're trying to get my attention that you want to ask a question. So I'm going to start my first question today with Sally and ask her if she can explain what canine leptospirosis is and how you guys at the health department track this disease in New York City.
Sure. Yeah. Thanks again so much, Anne, for having us today. We're so excited to be able to share what we've been doing and impart some of the findings we've had with you and your listeners. And so, as you so nicely explained, leptospirosis is a disease caused by a bacteria called Leptospira. And as you mentioned, Anne, it's zoonotic, which we say means it can be transmitted between humans and animals. And this is a disease that occurs globally, all around the world. And it tends to be most common in those areas that are warm, where you have tropical climates, but can also be found here in New York City. And every year we do see multiple cases of leptospirosis in dogs as well as in people. So, as you mentioned, in New York City, at our health department, we have this dedicated unit called the Zoonotic and Vector-Borne Disease Unit. It's a mouthful to have to say over and over again, so we call ourselves ZIVDU for short. And this is where Kevin and I work. And here in ZIVDU, we use a One Health approach, meaning an interdisciplinary approach where we look at human, animal, and environmental health to help monitor leptospirosis in both people and dogs. And, when you look nationally, there's no national system for tracking or counting canine leptospirosis. So we've borrowed from the human health world and came up with a surveillance system that we use to systematically count cases in New York City. So first, we had to update our health code. And in our health code, we've mandated that veterinarians and laboratorians are to report positive test results on animals to us here at the health department, just like we do in the human health world, where we require human healthcare providers and diagnostic labs to report positives in people. And then every time we receive a new report, we can begin an investigation. And what we're trying to do is learn more about the clinical course in the dog, right? It's like, what were their signs and symptoms? When did the illness start? And also see if we can figure out how and where they may have been infected. And so to kind of do this in a systematic way, we created what we call a case definition. That's getting a little bit technical, but essentially this case definition is for surveillance purposes only, right? Like we're using it as at the health department, but it's not something that's used in the clinical world to guide clinical management. And really what we're doing is looking at certain criteria that we gather through the investigation to see if the dog meets all the criteria that we need to count it as a case. And that allows us to do this in a systematic manner.
So then what are the signs of leptospirosis, and how do you make sure that that dog you're interested in actually meets that case definition?
Yeah, so most infections it seems that most infections are asymptomatic, right? So for a dog that becomes infected, the owner may never even know because that dog never gets sick. But for those dogs that do get sick, there can be a fairly broad spectrum of illness, right? But illness probably is going to include some degree of lethargy, dogs just not feeling right. They might have a decreased appetite or a complete loss of appetite. There might be diarrhea, some vomiting. A lot of times there's excessive thirst and urination, so the dog's looking to drink a lot more water, looking to go outside to pee a lot more than usual, and sometimes jaundice or yellowing of the skin and eyes. And with dogs, your furry dog's probably not so easy to see on the skin, and so it's something you're going to see that's more noticeable on the whites of the eyes. And in our really severe cases, it can lead to kidney disease, kidney damage, liver damage, vascular disease, and in some instances that can lead to death. And then in terms of dogs that meet the case definition, as I said, we're kind of looking at a combination of things. We're looking at the test results along with the dog's clinical presentation, looking at their vaccine history and whatnot, and again, looking to see if these criteria that we've established are met. So after we gather all this information over the course of our investigation, where we're calling the owners, talking to the veterinarian who saw the dog, we want to look at what kind of test was done. What are the results? Again, when did the dog become sick? Was the dog recently vaccinated? We know not all tests are 100% accurate, and sometimes you might get a false positive result. It seems that most often the test that's done is the test that's used to detect antibodies against Leptospira, but sometimes antibody tests might be positive because the test detected antibodies from leptovaccine, or maybe antibodies from an old infection with leptospirosis. Sometimes there's just cross-reactive antibodies in general. There's also molecular tests, such as PCR. Those are used to look for Leptospira DNA in a dog's blood or a dog's urine. And those molecular tests tend to be fairly reliable in that a positive result usually means the dog is infected. But if it is negative, it doesn't always mean the dog's not infected. And sometimes if there's a high clinical suspicion, there may be additional testing that gets done. So, considering all these factors, it's really important to look at all these pieces to determine if we're going to decide if a dog meets the case definition, and we ultimately count them in our case count.
So, Kevin, I want to bring you into the conversation, and you're the person who's tracking these cases and figuring out if they meet the definition. Can you talk about what your surveillance has shown in canine leptospirosis?
Absolutely, and thank you for having us here. Our data has greatly helped us in understanding leptospirosis in New York City, but first, it's important for us to note the limitations of the system before we go into the data. Most notable is that we're not able to capture every dog that gets sick with leptospirosis. Not all sick dogs are seen by a vet or maybe not receive a full diagnostic workup, which may be due to an owner's financial restrictions or inability to access care. So our data is likely biased towards dog owners who have the means of access and affordability to veterinary services, and therefore more likely to have lepto diagnosed and reported. But let's review what we've been able to capture. Overall, we've seen 298 dogs with leptospirosis across the city in all 5 boroughs between 2007 and 2022. We see an average of 18 cases per year with a wide range of as few as 13 in 2008 and our peak of 32 cases in 2018. Our last full year of analyzed data are from 2022, when we had about 20 cases, as you mentioned earlier. Brooklyn tends to have the most, followed by Manhattan, Queens, Staten Island, and the Bronx. We don't really see clusters or outbreaks of leptospirosis. Rather, it's individual cases and maybe rarely two dogs that share the same home. Cases occur year-round, but they tend to peak around late summer and early fall. We found that dogs of any age, breed, or sex can be affected by leptospirosis. The median age is about 4 years, and they range of 2 months to about 16 years old. Most cases were about male at about 64%, and most were spayed and neutered. Most cases we found were small breeds, but that might be reflective of dog ownership in New York City, and that was followed by the medium and large breeds. We also found that most dogs have kidney and liver disease, and the most common signs reported included vomiting, loss of appetite, and lethargy. Based on our interviews with the dog owners and certain test results, most dogs are infected with a strain of Leptospira that is commonly associated with rats. So in New York City, rats are the primary source of infection for both dogs and humans. Also, when we speak with dog owners, we may identify residences with rat infestations. We're fortunate to work closely with our colleagues in the health department's pest control program. They can work with property owners to implement rat control methods when indicated. And then also during these interviews with dog owners, we'll educate them, as well as animal health workers, about the risks and ways to prevent leptospirosis. I'll go ahead and turn it over to Caroline to speak a bit about what the city is doing to mitigate rats.
Thanks, Kevin, and I'm happy to be included in this conversation. Thanks for having me. So I'm going to talk a little bit about New York's Pest Control Services program. And we have a pretty robust rat management program here in the study. We've been looking at patterns of rat activity in the city for many, many years, and working closely with other city agencies. The health department is overall the lead agency in responding to rats in New York City. And our approach to rat control is both multi-pronged and data-driven. Our primary role is to perform inspections for rat activity. And then when we identify rat activity, to work with whomever owns the property to remediate those rat-related conditions. We have a program called rat indexing, where our inspectors walk block by block across the city to check every property for signs of rats and conditions that might attract rats. We also inspect properties in response to 311 complaints. When rat signs or conditions that may attract rats are observed, the property owner on file will receive a commissioner's order to abate. And this requires them by the health code to remediate those conditions. Then the health department comes back and checks the property to see if the owner has responded. If they fail to comply, owners are issued violations subject to fines. Here at the health department, we also have licensed pest management professionals, otherwise known as exterminators, who may also then follow up and conduct some extermination work on those properties. The health department works with property owners to offer free training on how to remediate rats. We want owners to know what to do. We offer free classes across the city in multiple languages on how to do proper rat management. We also publish written guidance materials in multiple languages on our rat information portal. And in addition to that, we make inspection results available online. So anyone can go at any time to our website and look up their most recent inspection. Our inspection data enables the department to analyze which neighborhoods in New York City carry the heaviest rat burden. Using the data and knowing that successfully combating rats requires collaboration, the department works closely with multiple city agencies to address the conditions that are attracting rats. If you are interested in learning more about this work, and we hope people will be interested, you can read about our rat mitigation zones on the health department website. And you can also look up your neighborhood's inspection data on the rat portal. Just go to nyc.gov/rats. I'll turn it back to you.
This is also fascinating because access to care is such an important point of discussion in veterinary medicine today. And never would I have thought that access to care would, I don't know why, because I should have, but it would limit our ability to really hone down on what dogs have lepto and where lepto is, because if the people don't have access to veterinary care or can't afford access to veterinary care, because we have lots of veterinarians in New York City, but there are limitations. So really an interesting One Health implication of access to care within the profession. So Kevin, let's go back to your lepto surveillance for 2022, and the cases kind of upticked in 2022. Do you want to talk about what you think might be behind that?
Yeah, absolutely. And that's a great question. Quick background for the listeners. We publish a surveillance summary report that's shared with veterinarians across New York City. We find that this report is valuable to the animal health community as it offers a very citywide perspective for them who may only know about the dogs that they treat. It's a nice way for us in the unit to give back to the veterinarians who help us a lot with our surveillance activities. So the uptick from 18 to 20 cases we find fairly small, as we've had years with much higher case counts, such as the 32 in 2018. But the increase does come after a few years of declining cases stemming from the pandemic. In general, the recent fluctuations could have been influenced by numerous factors, perhaps such as changes in the number of dog ownership, or perhaps changes in frequency of outdoor activities that stemmed also from the pandemic, right? It's really difficult to pinpoint an exact reason. However, shifting to a different lens, when we're looking at our human cases, we've seen a clear trend where the number of cases has increased over time. The numbers are still relatively small. Historically, we saw about 0 to 7 cases per year. But in more recent years, we saw about 13 cases in 2022 and 17 in 2021. I'll turn it over to Caroline again, who can explain a little bit more about the rat activity that's going on in the city.
Thanks, Kevin. So since the city reopened after the pandemic, we are also seeing an uptick in rat activity in many neighborhoods across the city. What we know is that rats thrive when they have ready access to food and water, a place to live, and effective transportation routes. And rats are very attracted to areas with uncontained garbage, especially food waste, grease spills, and food litter. Because rats prefer to live close to their daily food source, they tend to nest and breed in close proximity to areas that have a lot of uncontained waste or spills. Now, rats leave behind urine and droppings everywhere they go. So, in areas with high rat activity, you can pretty much assume that there is rat urine and droppings throughout that area. So what we usually advise is for dog owners to avoid letting dogs sniff around garbage areas and also anywhere else you might be seeing rat activity. And this will help keep dogs safe and limit their exposure to rats.
Yeah, I had a new puppy visit, and I said to the lady, now, should we vaccinate your dog for leptospirosis? And she knew about the disease and said, oh, I see rats every day when I'm out walking my dog. And I was like, okay, well, then it's a lepto vaccine for this puppy. So Sally, how can pet owners tell if their dog is at risk for lepto? And what are the ways that dogs can get infected? Clearly, Caroline has given us a hint, and that is sniffing around trash where rats might have been.
Yeah, we're going to be repeating a lot of things throughout the course of this. As mentioned before, in New York City, we find rats are the most common source of leptospirosis for dogs and for people. And, as Caroline mentioned, when in fact infected rats urinate, those bacteria are shed in the urine, right? And so these bacteria, they tend to usually die fairly easily when they're exposed to dry air or UV light from the sun, freezing conditions. Our household disinfectants can easily and quickly kill the bacteria. But with the right conditions, these bacteria can persist in the environment for weeks. They really like warm, moist environments. So think of puddles, think of waterlogged lawns and soil. And dogs and people are infected when these bacteria can enter the body through open cuts or fresh wounds, or even through mucous membranes. So think about the eyes, the nose, the mouth. And the risk of infection is going to be greater, like Caroline said, in those places where there are a lot of rats and where you have conditions that allow the bacteria to persist. So where do you find lots of rats? Just like Caroline said, where they're going to find food. What are conditions that allow the bacteria to persist in the environment? Just like we said, those warm, hot, humid, wet climate conditions.
So, Caroline, you want to talk a little bit more about rats and their persistence in New York City?
Sure. We do lots and lots of inspections here at the health department, as I said before. And I think the key is understanding that we see rats living in areas with uncontained garbage. And the more garbage you have in a neighborhood, the more rats you're going to find. So rats tend to congregate in the very most densely populated neighborhoods of the city. And to reduce rat populations, we really must work together cross agencies on eliminating rats' access to garbage and nesting areas. And this includes containerizing waste, repairing broken down infrastructure, like cracks and holes in sidewalks and building foundations, and also ensuring that waste is removed promptly from neighborhoods. It's also really essential that property owners, take responsibility for managing their own properties and hire licensed pest professionals when rats are found, and then to work closely with that professional on both treating the area safely and also removing the conditions that are attracting rats.
So then, Kevin, spinning off of what Caroline said, what advice do you have for my notes say for New York City dog owners, but really this would be for any dog owner to avoid lepto. This is just not a New York City problem.
That's correct. As Caroline just mentioned, rats are attracted to food, and there's often plenty of food found near trash cans, trash bags, and our numerous food vendors that we have in this city, right? In addition, keep them away from areas that allow the bacteria to persist where those rats urinate. The dog's owners should be aware of their habits and use that leash to curb their dog during walks. That can help reduce the risk of exposure and prevent that transmission. But it's also important for dog owners to know what is not a risk. A simple walk on a dry sidewalk, perhaps playing at a dog run, and being at a doggy daycare, for instance, they do not pose a major risk of transmission here in the city.
It's really, really important things because so many dogs in New York City love their dog parks and their daycare. So, Sally, do you think that the changing climate and the interface between the urban wildlife and people has anything to do with our risk of lepto?
I am so glad you asked that question. Like, we are all still learning about the impacts of climate change. And as we continue to experience the effects of climate change in New York City, we're also interested in learning about the disease dynamics of leptospirosis and other infectious diseases that we see here in New York City. But we do expect, as New York City experiences increased precipitation and higher temperatures and humidity that we see with climate change, that's going to allow these leptospirobacteria to survive in the environment for longer periods of time. And then the other concern is that, rats are likely to adapt well to a warming climate and possibly even thrive when using our urban infrastructure. So they'll likely continue to contribute to the spread of lepto in our shared environments. And I know Caroline has some thoughts too about climate change and rats. So I'm going to turn it over to her.
Thanks, Sally. So life is much tougher for rats in cold weather months. And the rat population gets very stressed out during extreme cold, which limits rat breeding behavior. So as winters get warmer and shorter in New York, it's contributing to year-round breeding by rats. So we're seeing that more litters of pups are born every year. And basically, we no longer have a cold winter assisting us with population control. So it's probably leading to an increase in the rat population overall in the city.
Yeah, I would argue we don't really even have winter anymore in New York City. This conversation has brought up a lot of points of things that are being discussed in the profession wide. One is access to care, and the other one is about lepto vaccines. Currently, the lepto vaccine does not appear on the recommended for all dogs list, but I've seen some things where people are discussing whether or not that vaccine should be recommended for all dogs. Sally, do you want to talk about the fact that many dogs in your report, in Kevin's report, weren't vaccinated against lepto? And do you know how effective this vaccine is?
Sure. So, I'll tell you what we know based on what we've read and a little bit about our data. So we do know it looks like vaccines do prevent leptospirosis. When we look at our own data for 2022, 4 dogs died from lepto. And looking at those 4 dogs, 3 of those dogs had never been vaccinated. The 4th dog, we don't know. We weren't able to obtain any information to know whether or not it had been vaccinated. And then looking at all of our data since our first full year of surveillance, so that's going back to 2007, as Kevin mentioned, we've had a total of 298 cases of canine lepto. And when we look at vaccine history for them, almost all of them, it's 93%, had never been vaccinated against leptospirosis. So from our data, and of course we don't have denominator data, right? So we can't tell you how many dogs are getting vaccinated, but the vast majority of the dogs that are being reported out have never been vaccinated. And then when you look at the effectiveness of the vaccines, we tend to defer to experts like yourself in the clinical world, and then also the American College of Veterinary Internal Medicine, or ACVIM. And from all that they've published, we know that current vaccines will protect against the leptospira strain that we see here in New York City associated with rats, or icterohemorrhagiae. And then, recent study of experimental trials of some of the commercially available vaccines found greater than 80% protection against clinical disease in dogs. That's great. These vaccines, once administered, are thought to protect for at least 12 months. And then, when you start this vaccine series, my understanding for many of these, it's 2 initial injections that you're going to space about 4 weeks apart. You can start it in puppies as young as 12 weeks later, and then repeat it annually. And then, in terms of adverse effects from leptospirosis vaccines, they seem to be similar to other vaccines that we give our dogs. And so while patient factors such as breed or size might influence some of the vaccine adverse effects, the rate's really not higher than what we see with distemper, parvovirus, or rabies vaccines.
So yeah, I would concur with Sally on the rates of adverse effects. I have some dogs that are predictably don't feel good the day after they get a vaccine, and then they're back to themselves the next day, which is kind of like when you get a flu vaccine or a COVID vaccine. So I don't think there's a higher rate with lepto either. And so I don't think that's a good reason not to vaccinate a dog. So, Kevin, part of your job is not only surveilling dogs with lepto, but also people. So could a dog give lepto? Could a dog give a lepto to their human? And should pet owners be worried about getting lepto from their dog?
It's absolutely possible for transmission to occur. However, through our surveillance in New York City, there are no known reports of owners or veterinary staff diagnosed with leptospirosis after living with or caring for a dog that had leptospirosis. Even in literature, there are very few reports of dog-to-human transmissions. Um, However, leptospirosis is a zoonotic disease, and both owners and animal handlers should take precautions, and that can include avoiding contact with their dog's urine by wearing gloves if they have an accident in the house, using household disinfectants, and thoroughly washing their hands after cleaning up.
Just normal good hygiene is going to protect people against leptospirosis. So mopping, washing, all that kind of stuff. So, Sally, if a pet owner thinks that their dog has leptospirosis, what should they do?
Yeah. So if a dog owner thinks their pet has leptospirosis, it's definitely important to reach out to their veterinarian as soon as possible. This is a bacterial disease, as you mentioned, and there are antibiotics that can be used to treat affected dogs. Those dogs that are left untreated, or maybe treatment is started very late in the course of illness, leptospirosis can progress to severe disease and possibly even death. So it's really important that antibiotics get started when leptospirosis is suspected. This might even occur, a veterinarian might even start antibiotics before the test results are back if they're highly suspicious, pending the clinical presentation of that dog. So really best to call your vet as soon as you think that's a possibility.
And at AMC, we have quick in-clinic tests. They're not perfect. As Sally already said, every test is not 100% perfect, but the quick in-clinic test is something that we do all the time if we have leptospirosis on our list of diagnostic possibilities. So I want to go to the Williamsburg outbreak, meaning that there were multiple media outlets in January 2022, so a couple years ago now, saying that Williamsburg had a leptospirosis outbreak. But yet your data says something different. What do you have to say about that, Kevin?
When news broke out about a report of cluster of lepto, we were surprised because we don't ever see clusters of cases. After the initial media reports, we started our investigation by calling the veterinary clinics around the Williamsburg area. We found only one case, as you said. Unfortunately, a dog that had died because of the infection. We did not identify any other cases or any information that supported the initial claims. But a joint inspection of a dog run in Williamsburg was done by the health department and parks department. And while they found only minor rat activity, several mitigation measures were implemented in and around that dog run. We want New Yorkers to have information about what is happening in their communities, but sometimes word of mouth can move faster than the findings from our investigations.
That and fake news. So this one was an example of where something kind of got out of control before you guys had a chance to do your good, thorough investigation. I think this also brings up another point. So lepto is a disease that New York City mandates that I, as a veterinarian, if I have a lepto case, have to report to the health department. But we don't have disease surveillance for most animal diseases. And that posed a problem when there was this supposed respiratory outbreak, kind of like last fall, kind of early winter. And one of the things that hampered that whole media frenzy about maybe not that much was that you guys don't have the data that you need. And so I think that's important for listeners to understand, is that our friends here on the show have a good process in place on lepto, but that's one of the few animal diseases that we keep tabs on. And so that's a challenge. So, Kevin, in addition to the rats, are there other animals that could transmit lepto? And what does that mean people should do to try and avoid? In New York City, obviously, it's the rat.
Yeah, so as described earlier, the bacteria Leptospira has adapted in a way that allows them to persist in certain animal species. There are a variety of strains that we call serogroups of the different Leptospira bacteria. These strains are associated with specific species. So this serogroup, Icterohemorrhagiae, for instance, is associated with rats. And through our laboratory tests and investigations, it's shown that this is the most common serogroup in New York City, indicating rats are the primary reservoir for both human and dog cases. In fact, a recent research study that tested rats for lepto found 30 to 40% of rats carried the bacteria. Other animals known to carry different strains of Leptospira bacteria include raccoons, mice, and even cattle and pigs. There's even one specific to dogs, and it's called Canicola. But thankfully, this serogroup is not seen here in the city. While these other strains are not common, it is still very good practice to minimize the exposure of dogs to environments wherever raccoons and mice can be found, as these could be the same environments where rats could also be found.
Yep. And we've got rats in New York, and we've got those cute little striped bandits, the raccoons that we see in Central Park as well. So we're really high on the lepto list. Well, I want to take this opportunity to thank my trio of guests today, Sally Slavinski, Kelvin Lovingood, and Caroline Bragdon, for joining me today on Ask the Vet.
Thanks so much, Anne. It was a pleasure.
Thank you so much for having us.
And if you want more information or to view the Canine Lepto Report, visit the NYC Department of Health and Mental Hygiene at nyc.gov/DOH. Thank you guys so much for being on. I know that keeping your pet healthy is important to you. And with that, I hope you'll reach out to me if you have a question about your pet's health. I'll respond to your question on next month's Ask the Vet podcast. All you have to do to get your question answered is email me at askthevet@amcny.org. Now we've got a break coming up, but stay tuned because there are lots of interesting animal stories and answers to questions when we return.
We're back with Dr. Ann Hohenhaus on Ask the Vet.
Welcome back to Ask the Vet. It's time for the animal news.
It's time for animal headlines, the biggest animal news from across the world.
Our first story is about a stingray. I don't think we've ever had a story about a stingray before. A stingray named Charlotte, who lives in a small North Carolina aquarium. And she is the center of a mystery. After it was discovered, she's expecting. But she doesn't have a boyfriend. No male stingray companion for the last 8 years. Initial theories were that maybe Scarlett had one of the young male sharks in the tank as a boyfriend, but experts said, no, you can't have a shark and a ray have babies together. So the phenomena thought to be behind Charlotte's unexpected pregnancy is believed to be something called parthenogenesis. Ooh, what a mouthful. It is a rare form of reproduction where the babies are produced with only a mom and not a dad. And that results in babies that could be clones of the mothers, meaning genetically identical, or sometimes the mother's genes kind of rearrange themselves and the mother and the baby are a little bit different. Charlotte is the first documented case of a stingray of her species resorting to parthenogenesis for reproduction. The reasons why this happened are not fully understood, but it's a fascinating subject for scientists and observers alike. Her caretakers expect that Charlotte is going to have triplets or quadruplets and should deliver any day now. The aquarium is posting updates on its Facebook page, which is facebook.com/Team Echo, ECCO. So just hunt that down on Facebook and you can probably watch Charlotte and her soon-to-be-born stingray pups. Our second story is a heartwarming one of resilience and hope. After the Maui wildfires, a family moved to Montana, but they have managed to be reunited with their cat, Mahina, who was lost during the devastating wildfires last August. After the fires, the family filed a missing pet report, but when they later moved to Montana, they lost hope of ever finding Mahina. After surviving alone for more than 100 days, Mahina was identified through her microchip, leading her remarkable return. The family says Mahina has adopted well to her new life in Montana, which, can you imagine, Hawaii to Montana just sounds like such a difference. She's an indoor cat, but this story highlights the importance of a bond between people and their pets, and also reminds us of the importance of microchipping our animal companions, making sure that chips are registered and keeping that information up to date. No chip, Mahina would still be somewhere on her own in Hawaii as opposed to back with her family in Montana. Our third story is Thibodeau, a 36-year-old white alligator. I didn't even know alligators could be white, living in the Omaha Zoo. And recently, Thibodeau had surgery to remove 70 coins from his stomach. The coins were discovered during a routine x-ray when the veterinarians taking care of this alligator found metal foreign objects in his stomach. So to remove the coins, the veterinarians had to insert a PVC pipe into the alligator's esophagus to protect his mouth and the delicate equipment needed to get the coins out of his stomach. Because can you imagine what those alligator teeth would do to an endoscope? Thibodeau has made a full recovery from this procedure and has rejoined the other alligators in his habitat. And every other alligator got an x-ray to make sure that there's not a need for coins to be removed from the other alligators. So where do these coins come from? No one knows for sure, but they assume that zoo visitors have been tossing coins into Thibodeau's mouth when he opens his mouth up, because if you tossed a coin into the water and it was laying on the bottom of the alligator pool, I don't think that the alligator could really pick those up. You know, they don't really have hands that pick things up, and their snout is not very good. You can eat a zebra, but it can't pick up a coin off the bottom. So visitors should know that you should never throw coins into the enclosure, the water, or the mouth of any animal in the zoo, because this is extremely risky and prevents a healthcare crisis for that pet that's absolutely unnecessary. So the zookeepers want people to throw coins into a wishing well that donates funds to the American Association of Zookeepers rather than into the enclosures and mouths of animals in the zoo. So folks, on behalf of my zoo colleagues, do not throw coins anywhere in the zoo except into the donation box. And finally, I just want to share a bit of information from AMC. Last month, we opened the Denise and Michael Kellen Institute for Surgical Care. And this new 7,000 square foot surgical facility features 5 operating rooms, a minor procedure room, and tell your cats, because they're getting their own recovery area, no dogs allowed. So this expansion is wonderful for AMC and adds surgery area from 61st Street all the way to 62nd Street, which is a huge change in our ability to do surgery. Such a happy day when that surgery area opened. And now we've had so much to talk about today that we'll only have time for one question from our listeners. But if you submitted them, I'll roll them over to next month's show. So our question today comes from Julie in New York.
Julie asks, what is the best way to help a baby bird that seems to be alone and injured?
So this is a really important time of year to ask this question, Julie. So thank you for writing in. So first of all, if the baby bird you find has feathers It's probably a fledgling, meaning a baby bird learning to fly, and his parents are probably close by. So leave that baby bird alone, and the parents are going to stop by, feed it, and take care of it until it figures out how to fly. If it's a nestling, that's like a thing that looks like a plucked chicken, those probably are not going to survive once they've come out of the nest by accident that way. So one thing you could do is to contact a wildlife rehabilitator. They're the ones who care for wild animals that are injured. And you can find your local wildlife rehabilitator by going to your state's Department of Natural Resources or Department of Environmental Conservation or some agency that sounds like that. And they're the ones who will take these injured babies and try and hand raise them. Certainly, if you think the baby is near death, you can go to a veterinarian who oftentimes will, sadly but courageously euthanize those babies in order to, take the best care that they can of them. Also, don't forget that you should always be careful around wild animals because they can be dangerous, and we don't want anyone to be bitten, scratched, or pick up some sort of infection. Now we're going to take our second break of the day, and when we come back, we'll have information from AMC's USDAN Institute.
We're back with Dr. Ann Hohenhaus on Ask the Vet.
Welcome back to Ask the Vet. I just want to share some important information from AMC's USDAN Institute for Animal Health Education. March is Poison Prevention Month, which is a good reminder that many of the poisonings that we see at the Schwarzman Animal Medical Center are everyday substances that are hazardous to our furry friends. Things like over-the-counter medications, prescription medications, your dog's own medication, or the dog dumps over some medications and the cat eats it. All of those things we see, and they are potentially dangerous for your pet. Also keep in mind that grapes, chocolate, and products containing the sweetener known as xylitol are toxic to animals. Cleaning products. We already talked about rodenticides. Rat poisons are toxic to animals. Insecticides. Don't forget to keep your recreational drugs, antifreeze, and essential oils away from your pet. All of these things are potentially life-threatening for a dog or a cat. Also, this is a good month to remember to be sure that your refrigerator has on it the ASPCA Animal Poison Control, that number 888-426-4435, or the Pet Poison Helpline at 1-855-764-7661. And although fees apply, it is absolutely worth every dime to have these experts talk to us, you and your veterinarian, about what your pet just ate. Senior pets, much like their human counterparts, may face both physical and cognitive challenges as they grow older. And what we describe in animals is called cognitive dysfunction syndrome, which is a degenerative condition that leads to a decline in brain function in aging pets, and we see marked behavioral changes in our dog and cat friends. So on April 4th at 6 p.m. Eastern Time, Dr. Kate Anderson and Dr. Pamela Perry, behavior experts from Cornell University's College of Veterinary Medicine, will discuss cognitive dysfunction in dogs and cats. As usual, this USDAN event is free and online, hosted via Zoom. But to attend, you have to register so that we can send you the Zoom link. And that registration can be found at amcny.org/events. For access to other timely and relevant pet health articles, upcoming events, tutorials, and pet parent education resources, check out the USDAN Institute at amcny.org/USDAN Institute. I want to take this opportunity to thank my guests, Dr. Sally Slavinski, Kevin Lovingood, and Caroline Bragdon from the New York City Department of Health and Mental Hygiene for giving us the lowdown on lepto today. A big shout out to all my listeners for your continued support, as Ask the Vet podcast is ranked number 4 on FeedSpot's Best Pet Podcasts. Don't forget, if you want to know more about your pet's health or ask a question, you can email me at Ask the Vet at amcny.org, and I'll answer your questions on our next show. The Ask the Vet podcast can be accessed on the Sirius app, across all major app platforms, and on AMC's website. All of this is possible with thanks to AMC's partnership with SiriusXM. Don't forget to check us out on social media, the Animal Medical Center on Facebook, AMCNY on Twitter and Instagram. Don't forget, take a moment and give Ask the Vet a review, and be sure to like and subscribe so you receive new episodes as soon as they drop. I'll look forward to working with everyone next month on another Ask the Vet podcast. Thanks and have a great month, everyone.